Good morning, Professor Grace. My name is Tauda. Today I would like to talk about asthma infographics. So first, a brief description of the disorder and what causes it. So asthma is a chronic inflammatory disease of the airway that causes symptoms like shortness of breath and wheezing. Asthma causes inflammation and narrowing of the bronchial tube, would lead to limited airflow and difficulty breathing. So what causes? When people with asthma happen, the muscle react by tightening even more. The lining of the airway swell and the airway can fill up with mucus. This makes breathing difficult and leads to asthma attack. So I find out the fact on the asthma.ca website. Asthma affects 3.8 million Canadians, including 850,000 children under the age of 14. Every day, over 300 Canadians are diagnosed with asthma, and every year, about 250 Canadians die from an asthma attack. In Canada, asthma is the third most common chronic disease. Next, who is at risk? Number 1, family history and genetic. Number 2, allergy. Number 3, premature birth with children born before 37 weeks are at increased risk of developing asthma later in their life. Number 4, lung infection. Number 5, occupational exposure, including gases, dust, particles, and chemical fume and vapor that can cause asthma in the workplace. The types of asthma is known as occupational asthma and is a common cause of adult asthma. Number 6, hormone. Like asthma is developed in women during or after menopause. Number 7, environment air quality like smoking, exhaust fume, and air pollution. And number 8 is obesity. So next, common sign and symptom. We have 7 common signs and symptoms for asthma is shortness of breath, regular coughing, wheezing, chest tightness, increased mucus production, trouble sleeping because of breathing difficulty, being unable to take part in physical activity without breathing difficulty. Then, methods of routine treatment. So number 1 is long-term asthma control medication. We have inhaler corticosteroid like flovin, HFA, leukotriene modifier like Zyflo. Combination inhaler, we have Dulera, theophylline, we have elixophyllin. So quick relief medication like rescue. So we have shock acting beta agonist like Pro-Air, HFA. Anticholinergic agent, we have Atrovent, HFA. Oral and intravenous corticosteroid, Revol. And allergy medication, we have allergy shock like immunotherapy or biology, Xolair. And number 4, we have bronchial dermolasty, used for severe asthma. During bronchial dermolasty, the doctor hits the inside of the airway in the lung with an electrode, so the heat reduces the moves muscle inside the airway. This limits the ability of the airway to tighten, make breathing easier, and possibly reducing asthma attack. So then, instruction to support the person to use the rescue inhaler. So we have 3 steps like before using it. We have ramp the inhaler first. You need to do this when you use an inhaler for the first time, or if you haven't used it for 2 weeks or more. Shake it for 5 seconds. Turn the inhaler away from you and press down to raise it. Wait a few seconds and do it again. Then do this 2 more times for a total of 4. So while using it, take off the mouthpiece cover, shake it for 5 seconds. Hold the inhaler up with your index finger on top and your thumb underneath to support it. Use the other hand to hold the spacer if you need to. Breathe out. Push the mouthpiece between your teeth and close your lip tightly around it. Make sure your tongue doesn't block the opening. You can also hold the mouthpiece about the width of 2 fingers away from your mouth. Press the top down and breathe it until your lungs fill completely, about 4 to 6 seconds. Hold the medicine in your lungs as long as you can, like 5 to 10 seconds is good, then breathe out. If you don't get enough air in the first breath, wait 15 to 30 seconds and try again. Check the canister again before the next puff. So after using it, recap the mouthpiece. If your medicine has a steroid in it, rinse your mouth and gargle with water after you use the inhaler. Spit out the water. Yeah, thank you for your listening. I hope you enjoy my asthma infographic. Thank you.